And thank you very much for the invitation to be here with all of you today. Also, I wanted to thank the Open University of Cyprus for organizing this meeting and all the partners from abroad. Before starting, it is interesting that most of the attendees today are women, and I wonder why. I wonder whether, as mothers of children with ADHD, you're more motivated to take part in this, or because as mothers or as women, the motivation to look after people with special, not disabilities, but let's say differences, is part of your role. Well, Maria introduced me already, so I would just say that I am a clinician, I'm a psychiatrist, I'm seeing only adults, so I cannot provide information about children with ADHD. And I should admit that when Maria invited me to this meeting, I felt quite uneasy because I had not too many things to share with you, because things for adults in ADHD, with ADHD in Cyprus, are very, very limited. When I first came in Cyprus in 2016, there was nothing. There was no colleague of mine to refer people with adults with ADHD. And that was the reason why I was involved with that back then. I will start with some general information first. Perhaps most of you are aware of that. But Cyprus is a very small country. The most updated data I found about the population is that in the southern part, we are around 900,000 people. We have roughly around 80 adult psychiatrists that are professionally active at this point. 30 of them work in public hospitals, 30 run their outpatient clinics through the national health system, and 10 work privately. Up to now, there is no state or NHS adult ADHD service in Cyprus, and there is no state or NHS, outpatient NHS adult autism spectrum disorder service in Cyprus. Although if we roughly estimate the prevalence of the ADHD around 2 to 5%, according to the population we have in Cyprus, we could say that around 20,000 to 45,000 people may need diagnosis or support for their ADHD. Well, I already told you that when I came to Cyprus, there was nothing for adults. When I started running my own private clinic, I had requests for assessment and treatment for ADHD, and I thought that it would be more appropriate to refer further to a specialist colleague of mine or to a specialist service to undertake the assessment and the treatment of adults, but I found nothing. At the time, the assessment for adults was offered only by school or child psychologists, only privately, and there was no psychiatric assessment for those people to rule out comorbidities or to avoid misdiagnosis. Back then, no medication would be prescribed for adults with ADHD unless they were diagnosed previously in their childhood by child psychiatrists, and the practice would be the adult psychiatrist to continue the same medication on the same dose without adjusting depending on the circumstances of that person. Well, today I found out that there is the ADHD Cyprus, that over the last years they have been very actively involved with adults with ADHD as well. And when I met them, they explained that their children are grown-ups now, so they needed somebody to look after the adults with ADHD. And we have at least 2 trained psychiatrists working and dealing with adult ADHD. To my knowledge, there is a colleague of mine based in Nicosia, and I am based in Limassol. Both work in outpatient settings. I work privately. My colleague works with NHS, with YESI. Well, I know that the clinical practices have been previously discussed in another meeting. I will not go through all that. I would just say that we follow all the good clinical practices that are adopted in Europe. I am trained in the UK, so I follow the guidelines approved by NICE, but they are similar, they are common with the guidelines of the European Psychiatric Association about adults with ADHD. I would also say that apart from the typical assessment, there is a need to look at any coexisting conditions and to rule out comorbidities. We need to focus on why the person requests such a diagnosis as an adult. We need to consider the social and the family circumstances at the time of the assessment. And of course, we need to focus on the needs that these people may have with regards to their education or their work. 2 issues that we very commonly come across is whether they are available as adults with ADHD to drive, and whether they should let the public transport ministry know about their disability, and whether they are able to serve in the army or to get a job as civil servants. Well, of course, as the rest of the European countries, the treatment includes psychoeducation, healthy diet, exercise, ADHD coaches. Please, if you know any in Cyprus, let me know, because we need them, and I'm not aware of many of them. We do have psychologists that can provide CBT for people with ADHD. And of course, we can provide medication if needed. Well, the problem with the medication is that we don't have the option of stimulants. I'm afraid that lisdexamfetamine and dexamphetamine are not available in Cyprus. We can only start with methylphenidate, atomoxetine, and prescribed clonidine. We don't have either guanfacine. Well, this causes a problem not only to the people that want to start medication and need to consider all the options available, but mainly may disturb the treatment of people that have been stable on dexamphetamine or lisdexamfetamine abroad, and they travel or they move permanently to Cyprus, and they have to change medication and get destabilized again. I hope that with the support of ADHD Cyprus and ADHD Europe, we will be able to get access to those medications soon. I should note that those medications are not options for children, and perhaps this is the reason there was no pressure up to now to have access to those. But as the demand for treatment for adults gets bigger and bigger, I think that this is a matter that we need to look at. Well, from my little experience over the last 4 or 5 years in Cyprus, when people get here to have their diagnosis, they feel relieved by just knowing why they struggle, why they behave sometimes weird in a social context. The diagnosis may help them to identify their strengths. They may identify the weaknesses, but at the same time, they may focus on what they can do. Also, they become more aware of the risks related to ADHD. They can discuss better about their impulsivity or about any substance misuse, mainly cannabis, I should say, or about their effort to self-medicate sometimes with alcohol, with cannabis, with sleeping tablets, and so on. And of course, they need to be assessed about their driving ability. After accepting the diagnosis, it is easier for them to get support for their social relationships, support for their work or education if they are still students. A challenge for clinicians that comes up after the diagnosis of ADHD is to see whether there are other neurodevelopmental disorders or mental health conditions. I feel that it is one of the biggest challenges we have so far, because most of people feel easy to discuss about ADHD. I should say that I feel that there is much less stigma for adult ADHD comparing to other mental health disorders. But can you imagine how shocking it would be for an adult to come here to get a diagnosis for adult ADHD and discover that they are in the autism spectrum disorder, for example, or that they may suffer from bipolar disorder as well. I'm not talking about other mental health conditions such as anxiety or mood disorders, because they are quite well known. I'm talking about bipolar disorder in ADHD and autism spectrum disorder with ADHD, because of their common genetic background and their big clinical overlap. Well, after getting a diagnosis, people are advised about the reasonable accommodation they could request at their schools or universities, about career choices that would make things easier for them, or about reasonable adjustments they can benefit from at work. I know that there is another talk after mine going through all that, so I'm not going to discuss that now. And I know that a colleague from Belgium, if I'm not wrong, will discuss about adjustments at work. So I'm not going through that detailed list, but the only thing I would like to say is that at least in Cyprus, employers are not quite aware of what ADHD is. So if we would give them medical evidence, a clinical letter about their employee discussing about their ADHD diagnosis and what adjustments they should offer their employee, perhaps they wouldn't understand. So I feel that it is our responsibility to train people, to train the employees about what this is, what the main problems are, in simple words, not in clinical, in medical words. We can discuss about the daydreaming, about the difficulty to understand complex instructions, especially if they are given verbally. So we should discuss with them to provide written reports, written instructions. We can discuss that the procrastination is not something that the person does on purpose, or that they may forget sometimes, and they should be encouraged to keep notes and so on. So yes, I feel that training teachers, employers, families is our responsibility as well. Well, another thing is that according to Article 21 of the Charter of the Fundamental Rights of the European Union, discrimination, any discrimination based on any disability is not allowed. The problem is that the interpretation of what disability is may be quite narrow in some areas, in some countries. So we need to clarify what for our nation, for our laws, disability is, and whether ADHD could be provided all the benefits that other disabilities are entitled to. In Cyprus, in order to request reasonable adjustments at work, the person needs to provide medical evidence. Here there is a paradox. If a person wants to apply for a civil servant job, medical documentation is needed in order to rule out any mental health, any health issue, including mental health issues. So most of people having mental health issues that do not affect their functioning do not disclose those difficulties with the employer. And the doctor comes after that to provide medical evidence of something they had not disclosed in the beginning. This is an area that perhaps ADHD, Cyprus, and we as clinicians need to discuss with our government what steps could be taken. Well, where we are now in Cyprus, there is quite raised awareness about ADHD in adults. It is through social media or through people already diagnosed in their childhood, and of course, their families. Most of people, when they come to my office to request diagnosis, they have been already self-tested online. However, there is an increased demand in proper professional diagnosis and treatment. Unfortunately, there is a lack of a specialist multidisciplinary team to assess those adults for ADHD. And of course, there is lack of clinicians to offer proper treatment, pharmacological and non-pharmacological. So we need to train health professionals in identifying, referring properly, and treating adults with ADHD. There is the lack of basic first-line medication I discussed earlier. There is lack of adult autism spectrum disorder services, and because of the great overlap, this is an issue. Well, apart from the employers, we need to discuss and raise awareness about ADHD in adults within universities, within our army, the Department of Transport, and other local authorities and communities. But after discussing, very positive, very optimistic that we have an organization that, like ADHD Cyprus, being so actively present in this area. There are initiatives from local psychiatrists and local psychologists and we are trying to become a local network now. We all know who are dealing with that, who have a special interest with that, and we try to refer to each other in order to try to cover the needs. But we also build bridges and keep the contact with European mental health professionals and European and worldwide organizations such as ADHD Europe, the European Network for Adult ADHD, where Cyprus is represented over the last 2 years, the UK Adult ADHD, and others. This is all what I wanted to share with you. I'm here if there are any questions from you, and I'm happy to be contacted for any ideas you may have in the future.
Thank you very much, Stella. Are there any questions for Stella? Any questions from the audience? Yes, Nikki has a question.
Thank you for this excellent talk. I would like to give me your opinion regarding the comorbidities and ADHD. As we know,
Regarding that
ADHD with comorbidities, we know that ADHD is...
Do you want maybe to come here? Can you hear Stella? Do you want maybe to come here? Because you will be closer to the microphone.
I cannot hear you very clearly.
Yeah, she cannot hear you clearly. So maybe
here?
Yeah.
Can you hear me?
Now it's better.
Yeah, now it's better.
Okay.
Hello?
So,
A bit louder, yes, please.
so we know that ADHD usually have a lot of comorbidities, and it's very rare to have a pure, let's say, ADHD. So when a person has one or more comorbidities along with ADHD, what do you treat first? And how you can distinguish what is the primary and the secondary conditions? Thank you.
You mean medical?
You mean medical?
Well,
Yeah.
sorry?
Yeah, she means medical.
Shall I move on?
Yes.
Medical, by medication. Okay, well, first of all, if we talk about neurodegenerative, neurodevelopmental disorders, such as ADHD or autism, you cannot have the primary one. Both come together. The challenge, the clinical challenge there is that sometimes in autism spectrum disorders, especially in high functioning Asperger's, people with high functioning Asperger's, ADHD symptoms could be part of their autism. In that case, it is not a comorbidity, but it could be a misdiagnosis if we give the diagnosis of ADHD in that person. That's why I find very, very important not to go through some questions in order to get a diagnosis, but we do need clinicians to differentiate the very slight differences, the very slight details between those two. So between those two conditions, I would say that there is no primary and secondary. They come together if there is comorbidity, or we need to consider only autism spectrum disorders that may have some symptoms like ADHD. For those conditions, medication cannot help. If there is autism only, medication cannot help. If we have proper ADHD, all the common medication used for adults with ADHD can be used in those as well. But if there are autism characteristics, then the psychotherapy is more appropriate, I would say. Now, for the other comorbidities, let's say anxiety disorder, mood-related disorders, including bipolar disorder, which has a very, very important overlap. If the person is misdiagnosed and the clinician misses the mood aspect of the disorder and gives medication for ADHD, then this medication may exacerbate, may make worse the symptoms from the other conditions. So for those, the priority is to treat the anxiety or depression or the bipolar disorder, and once they are stable, then to consider medication for ADHD. If needed, because if those symptoms are managed, if the depression or the anxiety in a person with ADHD are managed, perhaps they could manage with non-pharmacological interventions. So we need to reassess the need for medication, and if needed, we can prescribe then medication for ADHD. Am I answering the question?
Yeah, thank you. Is it okay? Yeah, thank you very much, Stella. One more question, yes, and the last one. Yes, please.
Θέλω να ρωτήσω πώς κάνει τη διάγνωση της, τι εργαλεία χρησιμοποιεί για διάγνωση.
Okay. There's a question for you, Stella. What sort of medical tools, if you can translate it so, you are using in order for the diagnosis? Diagnose an adult with ADHD.
Okay. There are many specialist services around the world that start with assessing ADHD without having proper mental health assessment first, which to my opinion is quite tricky. So I always start with a general assessment with a mental state examination to avoid any other issues that could be related with affected attention or with hyperactivity. And then if I feel that there are aspects, there are symptoms of ADHD, I move on by collecting information through family, or if there are school reports, some schools give very, very good school reports. And then I follow a very structured interview called DIVA-2, which mainly checks all the DSM criteria for ADHD in adults, which is not enough if there is not the clinical examination. So I wouldn't say that this is the main tool. Of course, there are screening tools as well, such as ASRS, for example, that could give a quick idea on whether we need to move further to a proper assessment. But if you would ask me what is the main tool I would recommend, I would say a very good history taking, including the developmental history, with a family member. If there are school reports or pediatricians' reports, we need to consider them as well. So a very, very good history, a very good clinical examination, and then I would check about other questionnaires or structured interviews. I personally use the ASRS and the DIVA-2.
Thank you very much. And follow what
She said ASRS and the other one?
Stella, you said ASRS, and the other one?
This is a very quick questionnaire, which is used mainly as a screening tool. It's not a diagnostic questionnaire. Then DIVA-2.
DIVA-2. Maybe DIVA-2. Maybe you can get DIVA. Is it right?
Yes.
DIVA-2.
Yes, right.
Maybe, yeah.
She doesn't do any like tests. Στο ελληνικά. Εγκαμνεί κάποια αξιολόγηση με κάποια ειδικά τεστ των γνωστικών δεξιοτήτων, ικανοτήτων του ατόμου γενικά.
Are you having any sort of tests testing the cognitive skills of the participant, of the adult?
Well, this is what we lack at this point. That's why I said that having a multidisciplinary team would be very, very important. I'm afraid I can offer only what I can do on my own. If I see that there are issues, cognitive issues like dyslexia, or there is from the history evidence of impaired cognition, then I would refer to psychologists that deal with that. But no, in order to get a clinical diagnosis for adults with ADHD, according to the European Psychiatric Association, neurocognitive tests are not required.
Okay, thank you.
Okay.
And yeah. Sorry to interrupt you, Stella. We have a question from the audience. Professor Panos Pavlidis from the Aristotle University. Is it okay? We answered your question, we addressed it, right? Maybe, Stella, because we are running out of time, there are more questions for you. What would you propose in order for these questions to be addressed? Maybe you can drop an email to Stella, or you can send us your questions, and then Stella, we can forward it to you. What do you think? Depending on her time, maybe you can put together your questions and we can forward it to Stella, because we have more speakers.
I'm more than happy to receive any questions.
Yes, she's more than happy to receive any questions. Yeah, thank you very much for your availability. So you will receive questions from Maria, sorry. And we have a question from Professor Pavlidis. He raised a hand, the last one, I think, and then I'm going to read you what's on the chat. Yes? Kalimera Panagiotis.
Hello, Kalimera. It was so nice to see and hear the lecture by Stella. We have been knowing each other since, when she was still a student in our school and doing her residence. Anyway, I was so happy to hear all this excellent stuff. Just one comment, that we are also running a digital intervention kind of research at the moment, and perhaps we could send you some details and we can collaborate if you can set up also some trial if you're going to have your own practice. So that will enable us to see whether the new digital tools can provide extra biomarkers, so to say, in completing the diagnostic arsenal that you have. So we'll be in touch.
That would be great. That would be great. It was a pleasure to see you again.
Okay, thank you very much. And there are some comments on the chat, like DIVA is available in many languages, and we recommend this tool by Professor Sandra Cook. It's another tool. This is a proposal by Chantal. Chantal, maybe you can send this in writing so that I can forward this information to Marina and disseminate information along the ADHD Cyprus network. Thank you. Thank you all. Thank you, Stella, for this intervention. Because if there is nothing else to ask, I would propose we go to our second speaker, because we are running a bit late. We started half an hour later. Yes, please.
To thank you very much and to wish you to have a very, very fruitful meeting today.
Oh, thank you very much, Stella, for taking the time to be with us. I know how busy you are. It's greatly appreciated. Definitely, people will get in touch with you, and we will address questions from members of the community. Thank you.
Thank you very much. Bye.
Yes, we will send you. You can see here on the internet. There is photos. I mean, somebody wants to see you. Come, Maria. By the time Maria wants to see you, by the time I just
share the screen, no?
You can come and sit in here because it's not very easy.
Μικρή. Δεν είναι μάθημα. Επειδή έχω ακούσει για αυτή, θέλω να δω.
If you go on the internet, you can find her. I mean, she closed her camera. Στο διαδίκτυο θα τη δεις. So, I'm putting forward the other presentation. So our second speaker is Professor Sιμώνη Συμεωνίδου from the University of Cyprus. She's a professor in inclusive education in the Department of Education. Her research interests include teacher education for inclusive education, curriculum development for inclusive education policy and practice, and disability politics. And she's actively involved in many networks, local and European, which promote inclusive education issues. Maybe Simoni, you can come here. And I will just. I will go back and share your. Share the PDF. I've got. Yeah, I have it on. So I put it forward. Okay. Here is Simoni. Just maybe to. No, it's okay. It's over to you, Simoni.
Okay. So, hi. Thanks again, Maria, for the invitation. I'm going to give you some information about inclusive education and how it differs from integration. And then I'm going to share with you some information about learners with ADHD in Cyprus. So, let me begin by how is inclusive education different from integration. Integration is the policy we have in many countries in Europe, including Cyprus. So what does integration mean? It means placement for some learners in the mainstream school. And I use the word placement with great consciousness because it means that we might just place learners there, but don't provide them substantial support in order to succeed and progress. We also talk about individualized support. So we place learner in the mainstream class, in the general education system, and we try to provide them individualized support, but usually we do that outside the mainstream classroom. So we have some different structures, special settings. For example, in Cyprus we have the special units where 5 to 6 children are gathered together to receive individualized support, or the special classes for special education or speech therapists where again learners receive individualized support. Inclusive education is quite different, but I used two pictures there in the end. You see on the keyboard there is the button integration and then there is the button inclusion, and we think that if we press one or the other, we'll have the same system. Inclusion is quite different. It's a different philosophy, it's a different system. So when we talk about inclusion, we talk about inclusion for all learners in the mainstream school, regardless their individual characteristics. So it might be disabilities, it might be children with migrant background, anything. All learners should be included in the mainstream school. And we don't only refer to inclusion as access, giving them access to the mainstream school, but also participation. They need to have opportunities to participate in the class and in the school life, collaborate with teachers and peers, receive support. Of course, they should receive support, and it should be individualized support at cases, but not outside the mainstream classroom, inside the mainstream classroom, and have opportunities to achieve, to progress. Whereas in integration, we don't measure that much progress. We are happy to have them there. So in Cyprus and in many other countries, we do have integration systems. We know they are failing learners, but we continue to have them. But the reason I put these buttons there with the different colors is just to make the point that more and more now we term integration policies as inclusive. It's a totally different thing, it's a totally different philosophy and system, but we term them as inclusive because we want to meet the international standards and the international discourses on inclusive education. So why is inclusive education, oh, there's a slide left behind. Okay. Why is inclusive education a necessary step forward? Because we know so far that parallel systems have failed struggling learners. What I mean by parallel systems is that right now we have two systems that work in parallel ways. It's the general education system and the special education system. And they co-function in the mainstream school or in separate schools, because we also have special schools. And I have an old reference there by Sprit in 1991, and I have it there on purpose, just to make the point that we've known for years that this system is dysfunctional, as it has been characterized in the literature. So we place learners in the mainstream school, but schools proceed without changing to meet the needs of the learner. They continue to function as they functioned before we had those learners in the mainstream classes. Another call in the literature now is that we need to confront ableism in the mainstream school. And what we mean by ableism? Schools are built around able students. And what we mean by able students are the students who meet the norm, the students who are capable to follow the content that the Ministry of Education in any country decided that is appropriate to their age. They are able to follow the conventional way that the class functions and teaching takes place for the whole class. So all the policies and schools are made up to meet the needs of the able students. And we are all caught up in this trap. We are trapped, basically, thinking that the system we have is for the able students. So anyone that cannot follow this system is not able, so they should be separated in another setting. More and more, we now talk about inclusive pedagogies. We need inclusive pedagogies, and the pedagogies we now follow are not inclusive. And I have a quote here by Lani Florian, who talked about inclusive pedagogies a lot, who says that inclusive pedagogy sets out to replace traditional approaches to teaching children identified as having additional or special educational needs that are based upon the argument that such children necessarily require something different from or additional to which is ordinarily available, and that what is needed can be matched to learner characteristics. While it does not deny individual differences between learners, it assumes that differences are an ordinary aspect of the human condition. So we don't deny that there are the individual differences, but we don't see children as needing something different from or additional to. We see that all learners need different things in order to be able to learn. And I've prepared this box here for you, and I'm going to read because maybe it's not clear at the end. If we have the integration policy, the learner is identified as having special educational need, and I use this term not because I like it, but because it's the official term in Cyprus still. For example, ADHD. And there's a multidisciplinary team that decides on the type and the amount of special education that the learner is entitled to. So the focus is on the learner, the diagnosis, and the type of support he or she will receive. But this leads to exclusion. And how does it lead to exclusion? The learner leaves the class to receive support. The learner is not supported adequately when she's in the class, and we have research in Cyprus and other countries that proves that. The teacher may design activities for the majority of learners and suggest that the learners who receive special education support do not participate because it's not necessary. And the learner is expected to behave and learn in the same way as the majority of his peers. This is ableism I explained earlier. If not, then the mainstream class is not considered an appropriate setting. So this learner needs to be removed. When we think in a system of inclusion, in the philosophy of inclusion, all learners are entitled to quality teaching. We shouldn't focus on the one learner. The teacher should differentiate instruction to reach all learners to ensure that all learners will participate and learn. And there's a whole literature about differentiation and how this can be done in mixed ability classes. The learner identified as having special educational needs is part of the class. she receives individualized support in ways that do not stigmatize or exclude him or her. So the learner receives the support he or she needs in the class, the time that is needed, and not outside the class. Because if we do that, if we keep doing that, providing the support outside the class, then the whole time that the learner is in the class does not actually receive any support. International European organizations have been trying to promote inclusive education for many years now. And I have here two important reports. The first one, you see the cover there in 2020. It's the General Monitoring Report, General Education Monitoring Report. It's called GEM Report. And it's dedicated in inclusion and education. And you see that subtitle there that says all means all, and refers to all learners, not just learners with disabilities. It documents the situation in Europe and other countries. Why does it proceed without? Okay. And says that there is a persistence in many countries to keep special settings working at a time we all know that they are not as efficient as they are. And at the same time, this is an international report by UNESCO. And then I quote there the Council recommendation from the European Commission on promoting common values, inclusive education, and the European dimension of teaching, which is really important as well at the European level, that inclusive education is promoted. Now, some basic information on the education system of Cyprus. You see there two photos from Cyprus. I've been playing around the internet to do this presentation to find the right photos for the right slide. So you see on the left-hand side typical primary school class with the teacher and the students sitting in their desks. So this is more or less our system. And you see on the other side of the slide the parallel system, special education, a special setting, a special class from a special school. And it's very similar to special units that we also have in mainstream schools. So the idea in special settings is that we have either one or small groups of learners identified as having a disability around a special education teacher and sometimes a personal assistant who receive individualized support outside the mainstream class. In this dual system, we have in the middle a common curriculum, and that's why you see the books with the different subjects there, which is supposed to be, we still call it new, although it's not new. It was introduced in 2010. In Cyprus, it's called the new national curriculum. In rhetoric, it promotes differentiation. So it has differentiation as a statement and says that we want to promote the humane and democratic schools. But in reality, the way it's written, it doesn't allow us to promote differentiation. So it's one thing to say it and another thing to promote it. Why is inclusive education a necessary step in Cyprus? Apart from the obvious that it's an international call, a European call, a call from researchers all over the world that we need to proceed to inclusive practices and inclusive education, I'd like here to mention a research we have from Cyprus that I conducted with a colleague, in 2020, where we reviewed and we analyzed about 70 documents from the two ombudsmen in Cyprus. The ombudsman for the, or commissioners I would say better, for the protection of children's rights, and the commissioner from human rights, Epitropos Dikisios in Greek. So we examined 70 documents they did to report on accusations they have and to investigate some cases about children. And what we concluded is that the main rhetoric that is used by the Ministry of Education is usually the dependence-independence divide. So children are judged on whether they are dependent enough to go to the mainstream school or be in the mainstream class, or they are independent enough to stay there. So we see statements that if children are not dependent, for example, they have a personal assistant, or they might have crises, or they might have often breakthroughs, then they are sentenced to special education settings. Then the other trend in this report seems to be that if you are independent enough, You'll go to the mainstream class, and we will see if you make it. So they give a probation period, let's say for a year. If you make it, it means you're independent enough and you stay there. If not, then again, you need to move to a special setting. This binary, dependence and independence, keeps us again trapped. And what the literature say and what we suggest is that we need to start thinking in terms of interdependence. None of us is dependent completely, shouldn't be, nor independent completely. Even if we don't have a disability, we are dependent to others. We are dependent to a good teacher, and the good teacher is dependent to having the children so that he has a job and has his salary. So we are all interdependent. Even the relationship between the personal assistant and a child with disability is interdependency, because the personal assistant, in order to be there and have a job, he needs the child, and the child needs the personal assistant in order to has the self-care that is needed. So as long as the discourse is there on dependence and independence, and the decisions are taken based on these two, then we are not moving forward. We need to change the discourse and to think in terms of interdependence. Now, what I've just mentioned are challenges for all children and are challenges for the education system in general. But I'd like to focus on the challenges for learners with ADHD. These challenges are similar for other groups of learners, but I think I've made out 4 challenges that I want to share with you that are really important for children with ADHD. The first one is labeling. And you see here again, in our system and in many systems, in order for a child with ADHD to get support, this individualized support that I mentioned earlier, which is outside the classroom, and it's so restricted, maybe it's 40 minutes per week or 60 minutes per week. So in order to get this support, the child needs to be diagnosed. And we see in Cyprus that children are diagnosed really early, because the kindergarten teachers see some children that don't fit in the class, they don't behave, they don't sit as many hours as the other children in their on their chair. So they start asking for a diagnosis. The diagnosis comes really soon in order to get the support outside the class. In my opinion, this is really not working, and it, if I can use the word, it predetermines, προδιαγράφει, a path of a special education track. Because if we label a child as early as in early years setting, then you know that then more and more individual support will come, and maybe these children will end up in a special unit, and they should not be there. So in my view, we need to be very, very careful on when the diagnosis is done and why. We shouldn't link the diagnosis with the provision of support. Support should be there for all learners, including learners with ADHD, or even learners that might have some characteristics of ADHD, but they might not have ADHD. And the other end that Dr. Spyridi mentioned earlier is that other adults go through the education system and they get the diagnosis after that, and they survive because they have a good support system. Because if they didn't have a good support system, they wouldn't survive this system. So we really, really need to be careful with the diagnosis, when it comes, why it comes, and it shouldn't be associated with support. Support should be available in classes for everyone to have. The second problem, in my view, is transitions. And transitions is not only a problem in Cyprus, it's a problem in different countries, but some countries try to tackle it. Because we have learners starting from the early years with some characteristics of ADHD, then they proceed to the primary school, to the secondary school, to the vocational school, and the university level. And each setting is completely different. Especially in Cyprus, the move from the kindergarten to the first grade of the primary school is a shock for all learners. Imagine for learners with ADHD, who might need their space to move, they need breaks to chill out, they need some maybe different chairs to sit on to find their balance, and these are non-existent in the first grade. And teachers persist, they have this persistent of sitting on your chair for 80 minutes, then 15 minutes break, and another 80 minutes on the chair, and so long. So it's really difficult to do this transition, without even preparing the setting and without even knowing what age group you have to deal with. So the teachers need to respect the age group. They also need to respect individual differences. Then the affect and learning environment. This does not cost at all, because what we usually hear is that our inclusion is costly and how we do everything that is relevant to inclusion and so on. When we talk about the affect environment in the literature, we mean the environment that makes children feel safe in their class. So we talk about teachers who provide motives, who understand the child, to see the child first before its academic level, to see the child interests, to see the child's personality. And you can understand that because I am also a mother of 2 children. And now, because of the pandemic, we talk on the phone with teachers. Last year, the teacher would say, oh, your son, he's this, and that. And he would characterize my son. She knew her better than I did, or the same as I did. And then she would comment on his academic progress. But then other teachers would say, yes, in mathematics, your son is this, and that. He doesn't sit on the chair so many hours and so on. He should sit even more. Sometimes he plays with his pencil. So you can see that these teachers focus on the behavior in the class and on the academic progress, and they don't see the child first. So we need to create this affect environment for all children to be safe, to feel safe, and to feel happy to be in the class. Because if we don't have them with us on the same side, then happy children to work with, and of course children who don't progress. And then the other 2 slides, on the other 2 photos. On the first photo, you see again a typical class in Cyprus, a class with desks and chairs, a class that gives us the message that the lesson that takes place in this class is not the way we would want it to be. It's not a differentiated lesson. It's a lesson where the teacher gives a lecture, and the children need to respond and do a conversation or write up something. For ADHD learners, we need classes that are flexible, that provide the time for them and the space to move, that have maybe different tables, and that we can arrange the height, you have different chairs. And all this is not just for us to see nice classes and lovely classes, but this comes with a differentiated teaching. So you use all these facilities, not only for the child with ADHD, but for all learners to do flexible grouping and work by ability or by interest or anything you want. And last but not least, it was also mentioned in the previous presentation, is the teacher professional learning. This is a great challenge for all countries, not only in Cyprus. In Cyprus, we don't have a teacher professional learning policy. We don't have some pillars that we consider important and that we would like our teachers to be educated about in the next, let's say, 5-10 years. We do some training seminars, but they are unstructured. From my experience, every year I get an invitation from the Ministry or the Pedagogical Institute saying, what would you like to offer to our teachers as training? And I decide what is good for the teachers to offer as training. But this is not a TPL policy. If we had policies, we needed to identify the pillars of training, and we needed to invest on those pillars, and not only in seminars with big groups of people, but also at school level. Then we need to rethink the teacher professional development throughout teachers' careers, because there are gaps between the education they receive at the university, then how they work as beginning teachers, then as practitioners with more years of experience, and then if they become leaders in the school, if they become head teacher. There are gaps in the education over these different paths. Also, teacher collaboration. You see in this photo here, I have 2 teachers working in the same class. If we had 2 teachers trained working in the same class, maybe a special teacher and a mainstream class teacher, or 2 mainstream class teachers, and if we had less students in a class, we would have maybe less children diagnosed with ADHD, because it would not be so evident. Not that it's a shame to have the diagnosis, but what I mean is that it would not be as a problem as it appears to be now. And also, teacher professional development at school level, which is very new in Cyprus, is non-existent. We sometimes do it if we have funds at the university and we collaborate with the school, and then we do the training there. is of course more efficient to do that, and you see teachers really learning because there's collaboration between university and the school staff, and there's monitoring of the progress. And this, I think, for me, is the best way to proceed in teacher professional learning. So moving on to the closure of this presentation, what are the suggestions? I already mentioned some of them, but just to summarize, I would like to say that if we want to move forward, we need to have a shared commitment on inclusive education, and not just change the word and say inclusive. Yes, we want inclusive education, but what we want is integration in reality. We need a shared commitment. We need to see the policy as a whole and not try to change parts of the policy. Right now in Cyprus we are discussing about the white paper on inclusive education, which is actually more about special education. It's not inclusive education. And you see that because we talk about one legislation and there are other 10 legislations that need to change. Or we needed to think of a greater reform. And I have the chain there, you might wonder, because everything is a chain. For example, in Cyprus, a hot issue now is the personal assistants and how much we need them, and if one child needs one personal assistant or they can share personal assistants. This is one part of the chain. The assessment of the learners is another part of the chain. The assessment of the teacher, which is a new policy, is another part of the chain. We need to see that these parts of the chain are interconnected if we want to have a chain. So we need to discuss them at the same level and not separately. The second thing is practice. We need to focus on differentiated instruction, train our teachers to do it, and demand it from our teachers to do it, and at the same time support them to do it. We know that there are very innovative ways to do this using the technology. They can have alternative materials to use in the class prepared for them, and the teachers could choose from those materials. But they need training and they need someone to expect them to do that, because right now differentiated instruction is voluntary. And the last for me is culture. We need to have a shared culture, not to exclude learners that do not fit the norm, but accept them and try to change our class and our behavior towards the students so that everybody is able to achieve. So this is what I had to share with you. Thank you. Thank you.
That was an amazing presentation, and thank you very much, Simoni, for bringing the educational lens on the topic, something that has not been discussed in previous meetings, because we were focusing on clinical symptoms and stuff. So thank you very much. I would ask for questions. If there are any questions?
Yes. Yes, it's a question and it's a position at the same time. First of all, Simoni, if I may call you like this.
Of course.
We welcome inclusion at schools. And speaking from a person that has been in schools 25 years, we've been looking forward to that for a long time. Teachers are ready, take it from me. Teachers are learning. They're people, they have trained to learn, and they learn. But as you have pointed out, to bring inclusion in our schools in Cyprus, the way I see it, is like moving Alps to Africa. First of all is what you said, ableism, and I will put it in more raw words. Curriculum is like a knife on the neck of a teacher, right? They have to follow it. I'm not going to take time, I'm just going to say this quickly because I have the need to say this now that Simoni is here, and she's a person who's making policies. She's from the
I wish. We wish she had the power to make policies.
I have heard a lot of things about inclusion from parliament members that they were standing down from the university. And the other thing, mentality, as you have mentioned, right, that stops us from progress. And the mentality that stops us from progress is that as Cypriots, we are overprotected people. We don't trust our children. We don't teach them in the schools independence. For the special education children to go to their class, they need to be escorted. even if they are 12 years old, because in the way there, they might just fall on the ground. And who are they going to be blaming? There's things that make you outraged. No? I don't know how you're going to fix it. I don't know. What I would say is that, sorry, you said about flexible class furniture. I work in a storeroom, no windows.
I worked in the same place as well. Because
Right.
I've been a teacher.
Well, I address this to you because I believe that you have in a position, or at least being at the university, that you have more power to put things forward. I'm not saying that you're going to make a big difference because everything is based on money. And nothing will change. What they're going to do with the inclusion policy, that you're saying all of this really nice, they're going to cut that legal help we give to the children. That's what they're going to do.
I'm sure it's a step backwards.
Yes, they're going to take advantage of that so they can save money. So this is my position. Please come to schools and see the situations.
Oh, I'm at schools all the time. Yes, Pablo.
So thank you for a very interesting talk. I just want to ask a question after a really gloomy story. Do you have any positive examples that somebody is already doing something positive regarding inclusion?
We have positive examples where there is a good network that supports the family, and families that are, found their way themselves. They read, they know, there's some other examples, they talk to other parents. For example, the organization CARE, it's the parents that push, and then we have some really good examples because there are some parents that push and there are good teachers on their way. But the problem is that not all teachers are obliged, if I can use the word, to do good practice.
So it's kind of bottom up.
Bottom up, yes. So my power, as Mrs. Costa said, is with my students at the university. I'm happy if I empower them, and if some of them follow this way of, because we have really good examples of teachers. Some teachers are really committed, but they don't do it because they have to, or because they are evaluated on that. They do it because they consider it's the right thing to do. So we really do have good examples, but this is the story behind it.
Thank you.
And one more, yes, please.
I want to ask how we can do this inclusive classes in real life. Like, what are the practices that you suggest? Because I'm really having a really hard time imagining it in an ordinary classroom, because there are 25 or more children. How we have to have 2 teachers? How is going to happen in a class of like 45 minutes of the lesson? How are we gonna cover up all this? Not we don't have to learn in such a short period of time, because remember, we have a short period of time, we have to learn lots of things, and lots of children with different needs. Like, I want to
one part of the problem is that we shouldn't have so much content in our curriculum. So curriculum should be, it's the first thing that needs to change, needs to be restructured. It needs to be developed in a way that allows differentiation, and we have such examples. We know how to do it, it's just that we don't do it. And as we see from the literature, inclusive education is a process. There is no way we do it in a year or 2. It's a process, and we need to prioritize. You need to see how you will find the funding, and there are money, because usually what we have from research again abroad, the money that is spent in special education is so much. Not a single government has cut from special education. So there are always funds in special education, but they are used in a way that is exclusive instead of inclusive. So we need to have a study to see how this money can be redistributed so that we have smaller class sizes. This is one part of the problem. 2 teachers in a class, at least for maths and for the Greek language lesson. Because you see, you prevent in this way. It's a preventive approach. Instead of putting all the resources to function a special school setting with 60, for example, I say now a number, but it's about 60 or 70 diagnosed learners that are in a special school, with about 60 people, adults, as a personnel. So imagine how much money is spent there, whereas most of these children could be redistributed along with the resources. But there should be a cost study in order to see how you do it money-wise, and also how you will change the culture, how you will change the curriculum, how you will change all the policies, and have some time limits. In 2 years we'll do this, in another 2 years we'll do this. It's not something that will happen from one time to the other.
Thank you. Thank you. Thank you very much, Simone. If there are more questions, I propose, because we have the focus groups later on, and Simone will be here with us
up to 1 o'clock.
Up to 1 o'clock, yes. That will be before, because Hans is waiting for his presentation. So if it's something quick, Marina?
Yes, just a statement. I want to thank Mrs. Simone because she's the person that when I was parent, she makes me to stop crying and to fight for the rights of my child and after for all the other child. And it is the reason that I am in this association because I learned a lot of from her.
Thank you very much. Maybe we can, we have, let me, so excellent presentation. So I'm reading these comments. Is it possible to have a copy of these slides about inclusive education, please? Chantal is asking for internal use. Excellent presentation by Professor Simώνη Συμεωνίδου. A lot of work to be done on European level. And this is from Chantal, from the ADHD women in Europe. If you want, there is another presentation by Hans now, and if it is fine with you, because Hans is with us for quite some time, I would propose to listen to his presentation. I mean, you can go and grab your coffee, because we are not going to have a proper coffee break. Feel free to get a coffee, come here. We will be listening to Hans. You feel free to move a bit if you feel. So after Hans, we have a short presentation by Marina, and we have the two focus groups with from representatives from ADHD Cyprus. So is it okay if we follow this program?
Yes, yes.
Yeah?
Yes.
So you can go and grab a coffee, something light to eat, and then Hans, thank you very much for being with us and for being so patient. I mean, all presentations were great here. So I'm going to upload your presentation now.
Just a minute. Can I share my new version, or do you already receive my new version in the email?
I've received the old version. I've turned it into PDF, and I will upload it now. But don't worry. Don't worry. I mean, you can tell this. You can expand on this if you don't mind. Is it okay?
Is it okay? Go ahead.
Yeah. Okay. So presentation will be on in a minute. So go and have it, grab a coffee, grab something to, small twist, yeah? So it's, oh yeah, thank you, Hans. Let me...
Priya?
Yes, Chantal.
Sweetie, I stepped out my room and I heard my name. What did you say about me?
I read your
messages. Okay, thank you.
Yes, I read your messages, and I wanted to make sure that you will receive Simone's presentation.
Oh,
so if I may, I can share to all of you the presentations that I have received from my colleagues. So I'm just uploading the presentation, that's Hans' presentation.
Oh, thank you, thank you.
You're welcome, sweetie.
Okay, my sweetie.
Just, it seems that there is a problem.
Can I share?
Yes, but first we need to
Where is the
upload
share button for me? Where's the share button for me? On the left in the menu?
Yeah, don't worry, I will share it now. I mean, I'm trying to upload your presentation. Okay, here is it. Sure now. And we have another meeting, another Stella, Dr. Spyridi saying, Maria, thank you for organizing this interesting meeting. I'm afraid I have to leave due to other commitments. I hope to get the recorded presentations. It was a pleasure meeting you all today, and hope keep in touch. No worries, and thank you. Thank you. Just a minute, Hans, because we are having a very short break.
No problem.
Yeah? Okay.
No problem.
Chandel, you asked me to, in terms of the program, I mean, it can be done. We can go first, and then Nikos can go last. Don't worry.
We will take it on board. He's making up 1 hour and a half.
No. I think everybody needs a 5 minutes break before we start. Yeah, we will be with you, Hans, yes?
Yeah. Yes. 5 minutes.
Yes.